Hello everyone, I'm Dr. Barry. I'm a board certified plastic surgeon here with Wake Plastic Surgery. And today we're going to be discussing some frequently asked questions related to some of our commonly performed procedures. So a breast augmentation is a surgery that aims to improve the size, shape, and symmetry of someone's breast with either implants, fat, or a combination. Anyone who seeks to improve the size, shape, and symmetry of their breasts are good candidates for breast augmentation. Also, people who are healthy and who have realistic goals. Sometimes people need additional procedures to get an ideal result. And so if they had changes related to the effects of age and gravity or changes related to pregnancy and breastfeeding, then they may benefit from improvement in volume, fullness, symmetry from breast augmentation, but they may also benefit from a breast lift, often in combination with that. So fat grafting is an option as far as breast enhancement or augmentation goes. Usually, we're only able to increase by a cup size at most when we do fat augmentation only through fat grafting or lipo augmentation as we call it. But we can also do that in combination with implants and do what we call a composite breast augmentation, where we place implants and also enhance the result further through fat grafting. So the choice of breast implant size is a very individualized decision and one that's made between you and your surgeon. There are many tools that help us to get to that decision. One will be breast implant sizers at the time of your consultation. Two will be a comparison with before and after photos that mirror someone who has a similar shape to yourself and a similar size goal to yourself, but also your body frame, your breast characteristics, including your diameter of your breast, your size, shape, and symmetry, as well as your goals for size and symmetry. And so all these are things that we consider and discuss during your consultation to get you to your ideal endpoint. The recommendation often is that these are not meant to be lifetime devices and that the lifespan of implants is often somewhere between 10 and 20 years. And so there is often a recommendation to have these replaced at 10 years, but there is no health risk to not having them replaced. And so if people have no problems with their breast implants, it is absolutely safe not having these replaced in that timeline. But oftentimes people may notice changes as we go, especially beyond 10 years, as far as implant lifespan goes. And so you may see changes in implant positioning that makes them unhappy, changes in your breast tissue around that implant that makes them unhappy. And so often if there is something that someone is dissatisfied with, that is a reason to have a discussion about possibly changing and maybe even adding additional procedures with that. And definitely for people who have complications, so whether implant rupture, capsular contracture, or any other issue with their implants that they're unhappy with, these are people that would benefit from an exchange or removal, either within those usual recommended timelines or even sooner. So in general, yes. There was a study done recently that showed that 82% of people were able to breastfeed normally after breast augmentation versus 88% who did not. I think the people who are at risk if you have any change in the sensation to your nipples, which is uncommon, but that could affect breastfeeding. If we have any significant disruption of breast tissue, so if an implant is placed through a cut around the nipple or sometimes even above the muscle, depending on how much trauma there is to your breast tissue, you could see a slightly higher chance of not being able to breastfeed. But overall, there isn't a very significant impact on ability to breastfeed after breast augmentation. In general, no, but it is important to let technicians know that you have an implant in place so that they can use some specialized views to better visualize breast tissue. And it's important to let your breast surgeon know that you have implants in place so that if necessary, they may recommend additional screening modalities or different screening modalities based on your specific circumstances. Usually there's not a lot of downtime after breast augmentation. Definitely up and walk in the day of surgery. Most people are able to resume light activity within a few days. We recommend avoiding any strenuous activity of the upper body, usually for around 4 weeks after surgery. But after 1 to 2 weeks, definitely easing into full activity is okay. Usually not a whole lot of pain and discomfort. Definitely after the first couple of days, most people are doing well from that standpoint.